I've been working in the licensed producer system for over 5 years now, and I've got extensive experience in supporting and educating patients, as well as developing patient care policy and departments. I am joined today, as usual, by my wonderful colleague, Jonathan Wierenski.
Oh, thank you, Barb. Hello, everyone. And thank you for joining us tonight for episode 4 in our series. I'm Jonathan. I lead up the cannabis counseling team at Canadian Cannabis Clinics, and I've studied cannabis for about 25 years. As always, please note that Barb and I are not physicians, and we're not providing specific medical advice during this webinar series.
Okay, well, let's start at the very beginning, and let's take a look at the very basics of cannabis oil.
And Barb, I'm just going to jump in right to that one and explain just what the different types of cannabis oil are exactly. So cannabis oil made by Canadian licensed producers is a form of cannabis medicine whereby the medicinal components are removed from the plant and then added to a food-grade carrier oil. Now, unprocessed, these contain the same 750 or so molecules and compounds as the plants do, but the exact ratios of compounds really depend on the specific strains the oil comes from. And again, the two main active substances in medical cannabis plants are cannabidiol, or CBD, and delta-9 tetrahydrocannabinol, or THC. Now, oil extracted from the hemp plant, that's anything with less than 0.3% THC, can contain a lot of CBD, while an oil from a higher THC strain will contain far more THC, Barb.
So basically, a cannabis oil is created by taking away all of the plant matter and leaving the medicinal compounds intact in an oil form. It really is a very fascinating process, and perhaps we should go into the actual method that's used, and maybe, Jonathan, you can speak to that.
Oh, sure. So manufacturing these cannabis oils is often done by a process known as supercritical fluid extraction. And it sounds pretty scientific, and it is, but it's pretty straightforward, really, to explain what it's actually about. So here, cannabis flower is packed into a large cylinder. Then carbon dioxide is blasted through that cylinder at extreme temperature and pressure to literally strip the constituent parts of the plant matrix. And because this process uses carbon dioxide and no organic solvents are used, Barb, the result is a highly refined and purified cannabis extract, perfect for making cannabis medicine.
Absolutely, and there certainly are other extraction methods, but this one is very popular because of the quality of the medicine that it produces and also the large scale of production that it can supply. Some licensed producer products, they will add all of the extract into the carrier oil, while others may select just specific cannabinoids and other parts to add to the carrier to produce a very particular type of medical cannabis oil. Some may have utilized certain cannabinoid and terpene ratios. Others may have had some cannabinoids or perhaps terpenes even removed, for example. So by isolating these specific cannabinoids and terpenes, the guesswork really is taken out of the equation. What this does is that it ensures that medication is, again, consistent and standardized. And this really allows for patients and physicians to make product choices that really best suit the needs of the patient. Yeah. So back to how oils are created. This extraction containing the medicinal compounds, you mentioned that it's blended with a carrier oil, and we certainly did mention that earlier. Perhaps we can talk about what types of oil are used and what they exactly are.
Sure. So the carrier oil is the base oil that the extraction is blended with. So pure cannabis extractions can be quite sticky, very viscous. So the carrier oil makes it easier to bottle and for us to use. It doesn't reduce the potency of the cannabis extraction or impact its effectiveness. And the most common types of carrier oils you'll find will be the multi-chain triglycerides or palm oil, sunflower oil, olive oil is also very popular. But if a person has any particular sensitivity to any of those oils or others, it's always best to just double check with your licensed producer who will have all the information available on their website that you would need in that regard. So we mentioned as well that no organic solvents are used during superfluid critical extraction. I think this is an important thing to mention. Barb, what is an organic solvent and why are they not recommended in this process?
So organic solvents, they're used often in dry cleaning as paint thinners, things like toluene, turpentine might sound familiar, nail polish removers, glue solvents, things like acetone. And of course, you've probably all encountered these in your daily life, enough to know that while labeled as organic, they certainly may not be entirely safe with regard to processing cannabis. And for this reason, super supercritical fluid extraction really is the preferred and much safer method for medical cannabis products. It's really important to stress, too, that extraction is really an extremely scientific process and one that is performed by licensed producers to medical grade specification. It's very high-tech, expensive equipment that is operated by trained professionals in a laboratory environment that is sterile, frequently inspected by Health Canada, which again is very, very important when you're looking at cannabis as medicine. And with regard to cannabis as medicine, one of the most popular questions that we are getting with regard to oils these days is about inhaled oils and oil vape pens. Now, Johanthan, is there a difference? Can you use oil from your LP in a vape pen?
Well, sure. There's a number of oil products on the gray market and in dispensaries that are commonly sold as cartridges and used with a special vaporizer pen. These are manufactured in a very different manner and not to Health Canada specifications. The cannabis used to create these extractions are not supplied by licensed producers. They're not a regulated product. And again, there's no guarantee in terms of strain type, CBD, THC, the content, whether it's safe or whether food grade production practices were used.
It's true, and for the moment, there are concerns as to the use of unsafe chemical additives, the use of plastics in the manufacturing of some of these pens, and of course, the long-term effects of inhaling cannabis oils. So again, for this reason, they're not yet cleared for medical or legal use. And it is a very, very good opportunity at this point to remind our patients that the oils that are currently available from licensed producers for medical patients should never be inhaled or used in a vaporizer.
Absolutely never.
Very important. Now, cannabis oils can also be created by extracting medicinal compounds from dried cannabis using a stovetop method. And Johanthan, I know that you are an expert on this, so I'm going to let you speak to that.
Well, they sure can be made at home. These extractions are really popular because they can be very safe, very cost effective, and easy to prepare in the comfort of your own home. Plus, many LPs have far more variety of dried cannabis products than they do of their oils. So patients can use whichever dried strain or strains they wish, and whichever carrier oil they prefer. I like butter myself, or even a particular oil not offered by any LP. So they can really expand their options, which is just great. And I think it's important to note here that homemade oils and edibles are topics that do require a deeper dive into, and maybe we're even going to get an expert guest on here to talk about some of that in our next episode. But there really is so much more to the subject. So we're going to be focusing in detail on that in our very next episode. So the next big question, how exactly do cannabis oils work, Barb? Can you speak to that one?
Certainly, I can. And so cannabis oils, they deliver cannabinoids and other cannabis plant extracts, things like terpenes, to our cells via the circulatory system. Now, if you've joined us for previous webinar episodes, you've heard us discuss the endocannabinoid system and the lock and key analogy. Basically, special receptors, which are the CB1 and CB2 receptors, on certain cells allow for the binding of cannabinoids. And once a cannabinoid binds to a receptor, and it works very much like a key fitting into a lock, it will affect change in that cell and therefore create a change in the system that that cell is part of. And again, that is the endocannabinoid system we spoke of in episode 1. So if you'd like to learn a little more in depth about that, please do revisit. So as we're discussing oils and oil products, what is the range of products available? I think people will be surprised to hear.
Absolutely. The amount of oil products available via the legal licensed producer system has actually increased dramatically over even just the last year. Almost every licensed producer now carries at least 2 to 3 products, in some cases many more. Last count, and just recently, there was over 80 different oil products, either bottled or encapsulated and so on. And so there are plenty of options available. These include the high THC, low CBD products across the Indica Sativa hybrid spectrum, and low THC, high CBD oils, as well as a variety of those balanced or the 1-to-1 sort of ratio products that are, again, across the Indica Sativa hybrid spectrum. There really is something for everyone, and that can be a part of a highly individualized treatment plan specific to any individual's needs.
And that's an incredible benefit, and it's certainly only one of many. You know, I think aside from the potential to be extremely effective in addressing and managing a number of symptoms, there certainly are a number of benefits to choosing edible oils as part of your treatment plan. First off, being ease of use. It's very discreet as well too. Basically, patients just take their drops and continue on with their day. So again, very, very simple to administer. Consistency and standardization, again, is a huge part of this picture. When patients are using cannabis for medical purposes, patients rely on having the same medication with the same results each time they use it. And this goes for any pharmaceutical product. Now, because oils can have elements added or removed, as we spoke to earlier, it really does ensure that the final product is always the same from production batch to production batch. And this really allows for consistent treatment of symptoms. And again, it really elevates your medical cannabis to a standardized pharmaceutical product.
Yeah, absolutely. And plus, no device like a vaporizer is required. The elimination of that added cost of a vaporizer can help patients on a limited budget right there. Additionally, there is no inhalation required, right? You're using an oil. This is ideal for patients who may have compromised lung function. There's no risk of consuming carcinogens that way. Oils have a slightly longer onset time than using a vaporizer, but the effects can last like 6 to 8 hours or more, making oils a really viable option for longer term relief of symptoms during the day or even overnight, which is very common. And last but certainly not least, there is a notion of stigma. And cannabis that is presented in a pharmaceutical grade form from a licensed producer and prescribed with the guidance of a knowledgeable physician carries the assertion that this is indeed legitimate medicine. It's extremely important to help remove stigma that can still affect some patients who rely on cannabis, and gives individuals new to cannabis the confidence that they are making a positive step towards their wellness.
Absolutely, and that is so important. We'll often speak of stigma, and it is great to see that barriers are now being removed for people, and oils, again, being a really big part of that. Now, I know that using oils and determining dosages can really seem overwhelming at first, but really with a little bit of time and practice, you will become very familiar and comfortable with using your medication. So perhaps let's walk through some really important information that is specific to usage.
Sure. So different licensed producers will use a different applicator, but the oil bottle will come with either a pipette, dropper type, or a plastic syringe. Most measure 1 milliliter in increments of 1/10 of 1 milliliter. So you simply draw up the dose into the applicator and then place it in the mouth and swallow. Some oils from some LPs should be taken sublingually, held under the tongue, or held against the cheek for a minute or two and then swallowed. Now, some patients may immediately swallow it, while some may add it to a very small amount of a beverage and then drink it all at once. Others may place the dose on a cracker or something, or perhaps take with a spoon of yogurt.
Yes, a lot of patients do find that cannabis oil can occasionally have a taste that some find unpleasant. So again, a little bit of, as they say, a little bit of something pleasant to mask the taste. Yeah. Highly advised. The medical community does generally advise taking oils with food on the stomach as well. However, if you have just eaten a large meal, you may want to wait about an hour or two for maximum effectiveness as well. That being said, whatever way a patient uses their oils, either sublingually or ingested, you should always use it the same way every time to achieve the most consistent results. And what is really great too is that for patients who may have difficulty measuring or using a dropper, licensed producers are now offering oils in a pre-measured encapsulated form. They look exactly like any kind of capsule that you would get either pharmaceutically or of an oil that you would buy at the health food store. If you take cod liver oil in capsules, they look exactly the same. And you mentioned earlier,
yeah, you can get it in vegan capsules now, which is fantastic.
Exactly. So for our vegans, there's something out there for you. Yep. So again, in this case, if you're using capsules, you start with just one and increase the dosage slowly over time until your therapeutic goals are met. So now that we've looked at the hows, let's really get into amounts and how much oil can and should a patient take.
Okay, so this is a challenging question, but we can offer everyone a simple answer. And it's a simple rule of thumb to go by. Start with the lowest recommended dose of the oil product you have. Do not take another dose for at least 8 hours until you've fully determined the effects it has on you. If necessary, one can increase the dose every few days, very small increments, until the therapeutic goals are met, and that's it. The fact of the matter is cannabinoid treatment and its success is going to vary from individual to individual, even if the diagnosis is the same. So there are many factors to consider apart from diagnosis, such as additional medications, cannabinoid tolerance, body weight, the type of cannabis product being used for sure. And the medical community always advises the same: start low, go slow. Each licensed producer has its own guidelines specific to the products they make. So your best option is to first speak with their care team directly for the recommendations when you place your first order with them. This is why we often recommend, as Barb knows all too well, that the first order might be best called in rather than ordering online, so you can speak to them directly about some of those things.
Absolutely. It really takes a lot of guesswork out of the equation. Now, what's generally accepted, on average, most patients will start with anything between a 0.1 and 0.25 milliliter dosage 2 times per day. Now, this can be increased both in amount and in frequency as needed, but again, over a few weeks' time. This, again, is where your period of investigation and journaling is crucial to find the right therapeutic dosage and the product. You'll see on the screen as well, we had a sample of the most common dosing schedule on average. However, again, it is strongly suggested that patients first check directly with their LP care team. So you'll see on the slide there, day 1 to 4, again, you can start as low as 0.10 milliliters or 0.25, often the average, 2 times daily, morning and evening. Day 5 to 8, titrate upwards to 0.5 milliliters 2 times daily, morning and evening. Day 9 to 12, go up to 0.75. And what you're going to do is you're going to continue to titrate upwards until you find therapeutic relief or notice a change. Or conversely as well, perhaps have a negative reaction, in which case you would discontinue immediately. Yeah. But that often doesn't happen. Most patients do, on average, will consume about 2 to 3 times daily, with an average of 3 milliliters of oil consumed total daily. So again, most patients falling within that 0.75 to 1 milliliter dosage. Now again, on to another very, very important aspect to discuss, and that is the effects of THC and CBD. Right. This is something that our listeners will really want to pay attention to and perhaps again revisit and re-listen to after the broadcast.
Absolutely, Barb. And we cannot stress this enough again and again. It's major, major differences between THC and CBD products and the effects that they have on the body and the mind. And this should be considered, especially when using oil products. We've discussed the basic differences between THC and CBD in previous episodes, and we encourage you to revisit our first 3 episodes to learn more about these important distinctions in greater detail. But for a basic recap, CBD does not have a psychoactive effect. So it is not generally going to create those feelings of euphoria or being high. As discussed in our last episode, CBD is generally considered safe to use and does not carry a risk of overdose or adverse effect. And to put it simply, a large dose of CBD oil should not have the same effects in terms of the level of impairment as a large dose of THC oil. THC will have a psychoactive effect and can lead to feelings of euphoria and feeling high. When using THC products in oil form, those effects will last much longer, up to 8 hours or more. And that being said, it is essential to wait at least a few hours between doses, regardless of the product you're using. And again, the lack of psychoactive effects make low THC, high CBD oils very appealing for those individuals who wish to avoid those feelings of being high, or for those who are new to cannabinoid treatment and as a daytime option. So if you're feeling wary of those psychoactive effects, start conservatively with a very low THC, high CBD product, or perhaps a balanced 1-to-1 product with very low THC.
I think it's important too that additionally, patients may notice a difference in the effects of their oils depending on what part of the Sativa Indica spectrum their product lies. Again, we've discussed the cannabis spectrum before in previous episodes, indica dominant oils generally will have a more sedative effect. Sativa oils may have a more energizing effect. Now, regardless of where they reside on the spectrum, overdosing on THC oil products can lead to a very unpleasant experience, especially for those new to cannabis and even for those who are experienced. And for this reason, again, it is so important to start with the lowest dosage of THC products and work your way upwards slowly over several days, weeks, and in very small increments. It's also very important to stagger your doses of THC oils, as we mentioned, and to wait at least 8 hours before consuming a second dosage, even if you don't feel any effects. And this is very important because certainly there have been instances of patients and just individuals using recreationally who may have taken a high THC product, felt little to no effect, and then consumed a second dosage within 1 to 2 hours, only then to find and feel a very significant and sudden response. And you really do want to avoid that scenario at all costs.
And an unplanned response.
An unplanned response, exactly. Now, of course, we do not in any way want to intimidate our patients. We really just want to give you enough information to approach using THC products with caution. Cannabis, again, is a very safe product to use. I can't emphasize that enough. When it's used responsibly and conservatively. Now, that being said, we do have some tips of what to do if you feel that you are having a negative reaction to a THC product.
Yeah, and one of the very first things we're going to say is relax. It's usually a temporary situation, and the feelings will pass before too long. The most important thing to remember is that no individual has ever fatally overdosed using THC or CBD products. Remind yourself that cannabis is a safe medication. You may have had too much, but it's going to pass. So don't panic. Lay down, soft lighting, breathe deeply. Consuming some citrus can actually help because it can actually help to get the THC out of your system faster. If needed, there's nothing wrong with calling a friend or a family member to come over and sit with you until the feelings pass. Now, in the rare event of increased heart rate, extreme anxiety, things like that, please visit your local emergency room. They can help you, maybe with a simple medication, help you have a little rest, get it passed through your system, and you'll be feeling much better. That's very rarely needed, but it is needed sometimes. So the next time you go to dose, be sure you take a much lower one. And I'll suggest waiting until the full effect of that dose has passed completely, Barb, before considering when to dose next.
Absolutely.
There is no need to rush during the process of establishing each individual's dose.
Exactly. And so for our cannabis oil novices, here's some tips on efficacy and really how to know when your medication is working. And this is even in the short term or in the long term. So in the case of using low THC, high CBD oil products, most patients report no psychoactive response, rather a gentle upbeat mood, perhaps some mental relaxation, but clear-headed again and focused, so with no real change in cognitive function. Now, a physical reaction may occur in the forms of pain reduction, muscle relaxation, and increased mobility. Now, moving on to, let's say, a one-to-one or balanced oil product with both THC and CBD, patients may note a very similar response, but perhaps with a minimal psychoactive and euphoric response, sort of a small lift. Now, in the case of using high THC oil products, certainly a noticeable feeling of euphoria or psychoactive response, increased appetite, pain reduction, absolutely common, as well as sedation, patients often report.
Yeah, and cannabis oil may be used as needed, as a PRN, like for flare-ups. However, as previously discussed, especially in the case of CBD oils, the effect may very well be best cumulative, meaning that you will want to continue using your regular dose regardless of whether or not symptoms may be present. We've seen patients who have stopped using their oils because they weren't sure if they were working, only to find that symptoms returned, of course. But because of the low risk associated with CBD, it's best to take it consistently. Ideally, you'll know if your medication is effective when you notice a reduction in symptoms, whether it be pain, anxiety, muscle spasms, mobility issues, appetite, energy levels, or sleeplessness. Again, it's important to note that many patients will experience great success with cannabinoid treatment, but it cannot be relied on as a panacea, as nothing can. And cannabis certainly cannot be called a cure-all. meaning it's important to be realistic with your therapeutic goals, and even a reduction of symptoms is an important gain. So, okay, on to another subject matter. An important aspect to consider is access. And Barb, you can tell us, please, where a patient can obtain proper cannabis oil products.
Of course. And as always, we do recommend purchasing your oil products directly via a licensed producer. This, again, it ensures you're consuming products that have been tested to conform to safety guidelines, and that is mandated by Health Canada, those guidelines. It really also ensures, again, that you are consuming the right type of medication, as it's clearly labeled in terms of THC, CBD content, and as well as strain type, whether it's an Indica, Sativa, or hybrid. Again, certainly with oils, there have been many claims that certain products can prevent or cure certain diseases. Again, I think it's important to mention that these claims to date are unproven in clinical studies, so those do need to continue before any definitive claim can be made with that.
Yeah, for sure. And in general, cannabinoid treatment should be viewed as a tool to help manage symptoms rather than cure them. Again, because we're looking at cannabinoid treatment for medical purposes, it's best to be used under the care of a knowledgeable physician and clinic, and purchase products that are produced in accordance with Health Canada standards rather than from a dispensary or an online or gray market dealer, whatever. But if you're looking for more information on safe access to medication and a physician, please revisit our second webinar where we discuss access.
Absolutely. And you know, there are so many questions, and I know we went a little over into question period, but fear not, we'll make sure that we get to everyone's questions either tonight via the chat, or you can email us at webinar@cannabisrx.com, and we'll have a response back to you in a few days. But I do see some questions coming in here. So let's perhaps start with Anne. And Anne mentions, she says, I have oil that was prescribed for back pain. Now that I don't have pain every day, I have cut back on the frequency of using the oil. I don't want to take it if I'm not in pain. If I wait to take it, when pain returns, I don't get relief for some time. So this is very interesting, and this question speaks to exactly what we were mentioning just a few minutes ago. Now, Anne doesn't mention whether she's using a THC or a CBD product, but I'm going to assume, and especially with CBD, that again, effects are often cumulative, and it's really in your best interest to really maintain those CBD levels within the body. Again, studies are continuing, but it seems like the endocannabinoid system appears to like to be a well-oiled machine that is constantly being given CBD. You know, and it is unfortunate that perhaps you may feel as though you're locked into the cycle of always having to take CBD. But again, when you're looking at that versus feeling pain, I think obviously your best answer is going to be to continue taking that medication to ensure that you are having continued ongoing relief.
Yeah.
So let's see here. I've got a question from Debbie, and perhaps did you want to field that one, or did you want me to take that one? Let's see here. I'll take this one. I am new to cannabis products. My doctor is having me try an oil containing 5 milligrams THC and 8 milligrams CBD for my sleep issue. I'm taking 1 milliliter before bed now, and it doesn't help. My question is whether I should be taking any THC at all for insomnia because of its high effect, or just sticking to a product with only CBD in it. And that is a great question, Debbie. And certainly CBD can have a calming an effect for some. And also the fact that it can address pain and inflammation, which can effectively keep you from sleeping well, it can certainly be effective. So it sounds to me like you are already taking a balanced one-to-one product with some THC. And again, this is a really great opportunity to revisit the cannabis spectrum. I would advise perhaps consider speaking with your LP or your clinic support and investigating products that are available from the indica side of the spectrum. And also to perhaps taking a look at terpene profiles as well. So again, indicas, the general conception is that they are calming, often used by a majority of patients at nighttime for their sedative properties. And myrcene is a terpene, and a terpene is part of the cannabis plant. And myrcene has been quite popular among the cannabis community for quite some time, and has always been associated with having calming properties. And also too, that it may encourage the resistance at the blood-brain barrier, allowing more of that THC into the brain. So it can be really highly effective at essentially kickstarting the medicinal effects of your cannabis. So again, Debbie, I would say let's investigate Indica and also two products that have a little more myrcene. That might be something to investigate.
Yeah, good answer.
So our next question is from Madeline. I have been taking 50 milligrams of CBD, 2 milliliters of CBD oil sublingually during the day for 3 months, and I find no relief from arthritic hip pain. The clinic is a little vague about the amount I might need to increase the dosage. They just encourage me to increase. Now, it's been suggested that some people need around 200 milligrams of CBD dose for pain, and that would be prohibitively expensive. It is quite a lot of CBD. Furthermore, I wonder how practical it is to administer sublingually. Boy, so that's a lot of questions. Have you had experience with people who get pain relief at around 200 milligrams but not at lower doses? Is this common?
I'm just going to jump over here.
Yes.
Sometimes less is more. Backing off, giving the endocannabinoid system a little relaxing time, a week or two, and then coming back with a very small dose can be a great way to restart things. And many people find they're very surprised at just how well things can work after that. And one thing I have to mention in Madeline's case here is that arthritic hip pain is among the most difficult pain to treat, and it's certainly among the most difficult to live with. So it's not easy to come at this with a herbal remedy like this, but a lot of people do find a lot of benefit from the CBD's properties of anti-inflammatory, and if it's arthritic hip pain, I would like to see some benefit there for sure. Absolutely,
and it's interesting that you mentioned doing a tolerance break and the fact that it can be very effective in essentially just resetting the system. There also was a very interesting clinical study in 2015 by a group of researchers in Israel at the Lautenberg Center. And what they found is that CBD, in many cases, and also a number of other pharmaceutical drugs, they demonstrate what's called a Bell response. That being when the dosage exceeds a certain amount, the therapeutic efficacy is actually lower. So again, you know, our instinct is more is better. But again, in the case of CBD, it could actually be that your therapeutic dose is sitting at a much lower level. So again, doing that tolerance break, rebooting the system, starting again at a low level and titrating upward, you may find again that there's going to be relief coming from there. Now, as to Madeline's question about sublingual delivery being more effective than, let's say, gastric, that's something that actually I'm going to do some research on because I learn with you guys too. But to me, it's interesting because I certainly have read online and had the discussion about cannabis oils perhaps being affected by gastric acids in the stomach and that perhaps impeding efficacy. But certainly, I think the real difference that people have noticed and researchers is that perhaps sublingually may have a slightly faster onset time. But I think most patients actually do feel the same effects, regardless of whether they swallow it or whether they put it under the tongue. Great. Okay, so let's see here. I've got another question. I'm just checking our time. We are doing well. So let's see here. Patricia has an interesting question about cannabis oil. She says, I'm new to cannabis. I've just started CBD oil on August 4th, so just a few weeks ago. Now, Patricia says that she has received 40 milliliters of CBD oil and 40 milliliters of a 1-to-1 oil. The bottles say use 1 gram daily and that 4 milliliters equals 1 gram. I am confused.
And rightfully so, Patricia. I'm so glad this question was asked. So the 1 gram per day is the maximum amount of cannabis that has been prescribed by your doctor. Some take issue with such wording as it can be interpreted to mean you're supposed to use 1 gram every day. Yeah, it comes down to the wording. It does not mean you need to consume that full gram every day. That's the maximum. You use the lowest amount as determined by your titration schedule, response, and journaling. start low, go slow. Do not start at that type of number. It's way too much for most people.
Absolutely. And this sort of leads to another question that Patricia's given us, which is, again, when patients are new to using oil, especially when they've been using dried product, it can be a little confusing as to what the equivalency of what this bottle of oil means in terms of dried bud. So again, in Patricia's case, she's been given 1 gram per day, which means that every 30 days, Patricia is able to consume or order the equivalent of 30 grams of dried cannabis. Now, I love doing math, so I did a little bit of math here. And what I calculated is that each bottle of Patricia's oil is equal to 10 grams of dried cannabis. So what this means is that Patricia can order 3 40 milliliter bottles of cannabis oil, either the 1-to-1 or the CBD, every 30 days until her prescription, and I think she mentioned that that runs until November, or medical document, as we like to call it, expires. So again, it looks like, Patricia, you have access to 3 40 milliliter bottles until November. But, and this goes for everybody, if you ever have any questions about the amounts that you're prescribed, how much you're allowed to order, the first people you should be contacting is your licensed producer care team, because they'll be able to look at your file, let you know how many grams you've got available and how much you're able to order. So that's the really easy way to figure that out.
Barb, I see, excuse me, Tina has sent in a question here that I want to take. So
I like this question a lot. This is a great question.
Yeah. So Tina says, if I add the use of cannabis oil-based topical cream, should I reduce the dose of oils I take sublingually? And if so, by how much? Okay. So this comes down to how you respond to the topical and to the oil orally. So yes, one can certainly use both, but based on the results you get. Let's say you apply some oil topically to a sore joint, and that makes that joint feel better for a time. Great, right? But perhaps there are other areas of pain or indeed other symptoms being treated, and it comes down to balancing the use of each product to maximize the therapeutic benefits of both. So if you apply something topically and the pain is eradicated, you might not need that oil by mouth. But it's a bit of a balance. So can you, and by how much? It comes down to what your responses are. I hope that answers that question.
That's a really great question. And I think we've got just about 4 minutes left here. And Johanthan, did we want to look at John's question here?
Absolutely.
Okay,
sure.
So John says he was diagnosed with general anxiety disorder a number of years ago. He started with THC and CBD oils in March and found that it made him feel more anxious. Now, at his follow-up appointment, he was asked to use only the CBD at a lower dosage, so THC removed from the equation. John mentions that after that, he felt more anxious. He also says that vaping was recommended, and so he tried Cannatonic, which is a low THC, high CBD strain. He's been trying this method in various doses and again makes no difference to his condition, which manifests itself in a very unpleasant manner, tightness and clenching. So his sense is that none of those options will help, even though he's read that the use of cannabis perhaps may not help those with anxiety, and he's looking for our input.
Can I take that one?
Absolutely.
Yeah, so thanks, John. This is a really important subject matter. First off, I'm glad the THC was removed because that can be an anxiety trigger for many. Now, I would want to know what your dose and dosing schedule looks like with the CBD oil and the dried Cannatonic, and whatever other meds you may be using, if any. So here again is perhaps reason to consider a tolerance break to reset the endocannabinoid system tone, and then come back to using just one or the other product, dried or oil, but not both. If you start back using the oil, you could try a single drop under the tongue once a day for a week or so, just to see how it goes. If there's no change, but no worse, you could go with maybe 2 drops under the tongue once a day, and so on. Very slowly, very slow upward titration. Believe it or not, this actually sets the stage for success for many, many patients. I know it can be trying when all we want is relief, but sometimes getting things dialed in just right takes time. So I'd say hang in there if you're going to keep trying. But what you've read is accurate. Some people simply do not respond favorably to medical cannabis. It isn't for everyone. So I hope that helps, John. But please send further questions on this to our webinar at cannabisrx.com team.
Absolutely. So I think we'll hit our wrap up now because we're getting pretty close to our 40-minute break. I really do just want to thank you all for joining us. It really is such a pleasure, and let you know that you can access this webinar as well as our previous episodes on the Canadian Cannabis Clinic's YouTube channel. Just go to YouTube, type in Canadian Cannabis Clinic's webinar, and you'll see it pop up. Do take a moment to subscribe to that channel because that way you won't miss out on future episodes as well. I know we give a lot of information during this, so again, really important to give you the opportunity to go back and revisit important things. And again, please feel free to share it with your friends or family, anyone who is curious about learning more. Our next webinar is going to be held Wednesday, September 19th at 7:30 p.m. Please do be sure to register and to share this information. The topic we will be discussing is going to be creating your own oils, baking, and edibles. It's going to be a really important one. I know a lot of people have been waiting for this. And as well, too, I do want to extend a huge thank you to all of you for joining us today, especially Sean, the magic man behind the scene. He's our tech guy and takes care of everybody. And also,
I definitely want to thank Megan and Graham over there for taking care of all the questions come firing in. They're doing a great job for us, so thanks, guys.
And again, please do feel free to follow up with webinar@cannabisrx.com. If your question doesn't get answered today, certainly we will answer them by email as quickly as possible. So again, thank you so much, Jonathan. Always a pleasure.
Oh, Barb, you're the best.
Thank you. And we hope to see you all again on Wednesday, September 19th. Take care, everybody.
Good night, everyone.